Actually started over the summer, which was unusual for RSV, and we'd see a couple of cases a day, and now we probably see a few cases a day, something like that. For sure, it's picked up and probably will continue to do so. The winter is sort of what we consider RSV season, if you will. It's probably still underdiagnosed. We diagnose it a lot more now because of the availability of our rapid testing that we do more and more. But even with that, it's one of the things over the years that we all think has been underdiagnosed. This particular medicine is really new. There has been a medicine sort of like it, which was a monoclonal antibody that's been available for several years, but the indications were very restrictive for certain subpopulations of infants with other medical problems, and it had to be administered monthly for it to be effective. So this was kind of a game changer for RSV prevention, since it is a one-time shot. A lot fewer people get this medicine that might be eligible for it. For that reason, we're going to see more cases than we might have seen had that been available. I don't know, is it necessarily going to be a lot higher number than it was last year, for example? I don't know. It may be trending a little bit higher this year, but it's still too early to tell. Oftentimes, the symptoms are indistinguishable from a cold, a bad cold virus. We think of RSV in kids maybe somewhere in between a cold and flu, so congestion, cough, sore throat, maybe a low-grade fever, something like that. I think as far as preventative things, it just sort of goes back to some basic common sense things with hand washing, for example, people being extra careful at daycare, since that seems to be a hot spot for RSV. If your child is sick, if you have a baby or a small child sick with respiratory symptoms, maybe it means you skip that next birthday party where there's going to be a dozen kids that all get exposed to the same child. So a lot of it is just sort of common sense things. Yeah, I mean, when it's widely available, I think the medicine will really help with the number of cases. I think people who are interested in this really should talk to their pediatrician and get their feeling for how at risk my child is and whether they should pursue that sort of treatment. Unfortunately, this fall, there's not going to be nearly as many babies receiving this medicine as we might have hoped. But hopefully going forward, it can really help.